Okay, so some more self-taping ideas for our patients that may have a ganglion cyst or some kind of scarring on the top of their hand, even their TFCC scars or scars at the base of the thumb. Sometimes scooping this tissue up or making the skin glide distally is super helpful. But the one I really like here is when the scar is deep and kind of penetrates there, even maybe an extensor tendon scar. So you can take your tape. You only need it to be about 2 blocks long. So there's the 2. Okay. We're going to round this edge right here. Round the edge. And it's going to be about 2 blocks in width. So we'll cut across that like this. And round our edges. And let's get another color that's kind of fun. Again, about 2 blocks. So about 2 blocks. And we're going to cut it thin. It's going to have rounded edges like this. And what we're going to do is say this is a scar. I did have a scar right there. So I'm going to want to be on either side of that scar with the goal that I'm going to lift that scar up because it's kind of stuck down. And every time they're trying to move their tendons, that scar is stuck down. So we take our piece of tape, tear it in the middle, like so. We're going to anchor. We're going to put our wrist in some flexion. We're going to anchor the tape, just one little spot right in the middle. And then we're going to keep that finger on there and pull this tape around to the side with no tension on the end. Same on this side. Pull it back with the tabs, pull it around with no tension on the end. Okay, and then we're going to take our other piece, so now it looks like this, and we're going to scoop it the opposite way. So we're going to take this right here, take our piece of tape like this. Again, put it on a stretch. If it's very tight on a full stretch, put it on a comfortable, pain-free stretch. Keep your finger here again, glide that tape and end with no tension. On this side, same thing. Glide that tape, flexion, glide that tape, end with no tension. Rub it to make sure it stays. And then when they move, you'll see that the skin lifts up and away from that space. So it's super pain relieving. You can see it on my scar as I do it. It puckers in. So this would be a good application for a scar that's really stuck down, and then you have this nice lift. It could help if you did it on the outside of the wrist with TFCC scars, and so we'll make a video to show you that.